welcome back to the Cozy Lung Lounge. My name is Kelly Lewis.
I'm Amy Sheldon.
And I'm Gina Hoots.
What's our topic today, ladies?
We are going to be talking a little bit about how to take care of kids when you are also managing a pulmonary health condition or a pulmonary disease.
What a great topic. I just talked to a lady today in the emergency room waiting room who was raising her grandchildren. I find that a lot.
That does happen a lot. It's very difficult when you have a chronic lung disease to keep up with these little ones sometimes, is it?
It is. There's toys. They're running about your feet. They have all of their own gadgets. And as someone with a chronic lung disease, we probably have a lot of our own gadgets laying about as well. You know, you've got a nebulizer with medications and pieces and parts to a nebulizer. You might have inhalers that need to be put up because little fingers like to push, 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 push. You may have an oxygen cord that gets in the way and gets tangled in all the little feet. Those are all really good considerations.
Definitely put away any medications. Kids don't know what's what. They like to play with things. Nebulizers, not a toy. Oxygen tanks, especially, make sure they are secured and that they're not turning knobs on your oxygen tank or your concentrator when you're not looking.
That's true. If you're not feeling well, check the setting on your concentrator. It could have gone up to 6 or down to a half. That's a good point, Kelly.
What about a routine? What happens? There's a difference, I think, between a grandparent that is raising their grandchildren and having the grandkids coming to visit. And I have a friend who has 4 kids, and she has a grand total of 7 grandchildren. So she had 2 of her children visiting and 5 of her grandchildren visiting. So 2 of these grandkids belong to one of her children, 3 of them belong to the other one, and those 2 children of hers had very different parenting styles. So trying to get any kind of a routine together for these 5 grandchildren was absolute chaos because the parents did things very differently. So do you have any tips for situations when all the grandkids are visiting and you've got several different parenting styles happening?
So I really like that question. In that situation, you have parents in the house. And so really the parents would be the key caregivers. For somebody with lung disease, continue taking care of yourself and let the parents take care of those children. If they leave them alone with you, that's a different story. But with that situation, with there's parents in the house and the kids, let them go with their own routine. That will minimize any arguments and other kinds of problems. What do you think, Amy?
I agree. And, you know, you can be as hands-on as you want to be and as hands-on as you are able. But ultimately, in that situation, I would let the parents do a lot, and also to let them know and communicate with them about that and just say, you know what, I have my own routine that's important for me and my health. And so while I will be here and I'm going to be a supportive and a very attentive grandparent, I also need to make sure I'm doing the things that I need to do so that I can be here with everyone. So I think communicating those points and even having, you know, the parents telling the grandkids, we have to give them their space and let them follow along with their schedule is really important.
I think that brings up an important point to be able to, as far as your self-care goes, which we're going to talk about in the next episode. But if your children really don't understand what you need, then they're going to have a hard time conveying to your grandchildren what you need. So starting your sentences with I and saying, hey kids, I need this. I'm going to need time to do my nebulizer. I'm going to need time to go exercise and walk around the neighborhood for 15 minutes. Start your sentences with I and then let the kids pass that information on the way that they do it.
When we are taking care of our grandkids with the parents in the house, pick a couple of things that you might want to do as priorities. For example, are you cooking Christmas cookies together or a family meal? Make sure you do that because that's what you want to do. Don't clean up after everybody and use up all of your energy that way. Focus your energy on things that are going to be most productive for that family meeting.
And absolutely, just make sure you're not trying to do too much. Sometimes you only get to see your grandkids a certain number of times a year, and we tend to pack it all in and do everything that the kids want to do, and we wear ourselves out doing that. So make sure that you're scheduling yourself appropriate for your stage of things that you want to do and are able to do.
There are a lot of grandparents that I know that don't have the luxury of giving the grandkids back to the parents, but rather they are foster or adoptive grandparents. Amy, what do you recommend for those of us that have to raise children full-time in our 50s, 60s, and even 70s?
I think kind of what we talked about before is routine is so important. Not only do children thrive with routine, but also it's really important for our pulmonary patients to make sure that they're getting all of the things that they need to do. And also, like we talked about before, communication is really important. Just like you want those children to communicate their needs to you, you also need to communicate your needs to them and let them know, I have to do these things, and so we're going to make a schedule. And there's also really fun ways to work in your exercise. You can have your grandkids do it with you if you really want to. If they want to engage with you, you can make it kind of a fun thing where you all exercise together. You go on an afternoon walk, something like that. Or make your flexible schedule with your exercise as well. You could exercise when they're at daycare or they're at school, and finding different times for yourself, either to have them exercise with you or to exercise separately whenever they're busy with some sort of homework or at school or something like that.
I think the exercise part is very important, just keeping up your strength, but also your endurance. I don't know about you all, but I don't have the endurance now that I had at 20 and 30. So keeping up the endurance, and also just the flexibility. If you have really young kids, do you have to pick up these children? It's very different holding a baby than it is trying to lift a 3-year-old who wants, up, grandma. It's a little bit different. Do you have to put them in a car seat? How do you have to move? What's the best way to move and breathe if you have to put a child in a car seat or take them out of a car seat? How's your balance when you're putting them in and out of a car seat? Just a lot of things to think about, especially if you're new in this role.
Strength is so important when it comes to taking care of kids, whether it's getting things for them, holding them, like you said, moving the car seat. But then also, if you think about endurance, if they want to, play catch in the yard or they want to play tag, something like that, it's important to be able to keep up with them. And then when you think about flexibility, not only is flexibility important when you're trying to hand somebody a cup while you're driving and they're back behind you, but flexibility is also important for your rib cage to help you be able to take bigger, deeper breaths. So it's really important to do some good stretching. And then, of course, we talked about balance. It's really important to be comfortable with your balance. And the last thing that you want to do is fall, then get injured, and have a harder time taking care of those kids. So all of those exercise pieces are very, very important.
Do either of you know if for a grandparent, either raising grandchildren or even if they are just going to watch the kids for the weekend, is it a good idea to enlist some help some way? Is there any kind of respite care available for grandparents that are actually raising their grandkids? And even if it's just a weekend, should they think about having somebody be there with them?
That's a great idea. I think that's really important to know your limitations. You can't manage 5 or 6 grandkids all at once, just every so often. You have to work yourself up to that kind of challenge. There are organizations, I had one up here somewhere. Definitely your local foster care agency would be really helpful, especially if you have those full-time ones. Foster care agencies can give you some respite care. Grandfamilies.org is a national advocacy organization that could also help with some of that. You might have neighbors. You might have friends and family. You might have none of those. If that's the case, enlist the help of some of the kids' friends' families, because another family with a 6-year-old wouldn't mind having your 6-year-old over for an afternoon or perhaps overnight, and that would be really helpful for you. Another thing that I'm a fan of, I've got a bunch of kids, and this goes with routines, independence, and help. Everybody can do their own chores. So even at the age of 3 or 4, children can help you do basic household chores. One of my favorite things is everybody to have their own laundry day. So everybody's laundry stays in their own little hamper at their own bedside or wherever, the bathroom. And then on the laundry day, the child can come bring their laundry to the machine. Depending on the age, you may have to help them unfold it, putting in or out. But they can put the clothes in and out and put them away. Same with dishes. They can do some parts of the dishes. You have to get over that it may not be done correctly or well, but they're going to get done and they're going to get better with age. So really, having the kids working in the household is really important for everybody's independence and mental health.
Kids can always help out with chores. They have lots of energy and they need to burn a lot of energy. And so doing stuff, of course, that is safe for them is really important in helping you and also helping them, one, burn that energy, but also learn how to do important tasks around the household. So when they're older, they'll also know how to do those things. So it helps in a lot of different ways.
And if they say they don't know how or can't, don't let them off the hook. They know how to operate an iPhone. They know how to operate a PlayStation. They know how to do all the things they want to do. They can also do laundry and dishes and just some basic things for grandma and grandpa.
Just be careful if you've got little ones. Teaching a young child how to wash their hands real well before dinner or after using the bathroom requires a stool. And don't forget that you put a stool there. Same thing if they're helping you wash dishes at the sink. Don't forget there's a stool there. Don't trip over things that you put down to help your little ones do their chores and do what they need to do.
Kelly, that brings up a really important point. Little ones have a lot of germs. Snotty noses, grubby hands. All of my little boys, their hands are always sticky. That is germs to be transmitted to the sick, not sick grandparents, but more susceptible grandparents. So washing hands is super important for this family. You may even want to wear a mask if they brought home something from school with a snotty nose and you can't get away from them.
And I think lastly, amidst all the chores and getting ready for school and all the things that we have to do for these kids, don't forget to schedule some fun time. And that is not just letting the kids sit there with their PlayStation, some fun time where they learn how to do a puzzle, where they learn how to do something that is good for you as the grandparent, but also fun for them, that you can engage with them, but not wear you out.
Share some of the favorite movies you had from when you were a child. Some of the things that you did with your grandparents. They're not going to get that from younger parents. These are things that the grandparents really can value. New is not always better. And, you know, with age does come wisdom. So use your age as a weapon and use some of those things that you know are good for their brains and their bodies that you might have done when you were a child and implement some of those fun things.
Absolutely. Just remember, every time you have to bend over to do something, you're kind of squashing your diaphragm a little bit up into your chest. So if you have to dress a young child, could you, rather than bending over, could you sit the child on a bed or carefully sit the child on a table and hold on to them while you're helping them get dressed or whatever it is they're doing? Just remember, every time you have to bend over to do something, to pick something up, to whatever you're doing, you're squashing your diaphragm and you're compressing your lungs. And you don't want to do that if you can help it.
Amy, when I take care of kids like that and I bend over in that wet matter, the middle of my back hurts terribly. Why does it hurt that way and what can I do to prevent it?
So a lot of times when you move like that, it could hurt because your back is tight, or it could hurt because your back is weak. So those are two really important things that are different. So the biggest piece is to strengthen. And when you say that your back is weak, the other important thing that you need to strengthen is your core, because your core and your core strength can really also help protect your back. So when you say, okay, my back hurts, you need to think about the opposing muscles that are working with that, and not only focus on strengthening your back muscles lightly, but also focus on some supporting muscles, making sure your legs feel strong, making sure that your core feels strong to really help your back. And then again, just doing some nice flexibility and some other stretches that will really help just slowly loosen up that back, because those could be two big reasons why it may be uncomfortable.
Also, if anybody hasn't really had a recent lesson in body mechanics, just making sure you're not bending over and twisting at the same time, using your legs rather than your back to do the work, and making sure you're not hunched over, that you have good posture when you are standing straight, and just making a note of just keeping everything in alignment as best you can.
And if there's things that you can avoid, so if you have a grandkid who can walk but wants to be picked up, you can say, I can't pick you up while I'm standing up, but let me go sit on the couch and then I can pick you up and hold you. And making some adjustments like that could be really helpful to make sure that you're not straining yourself and that they also get the attention and love that they want.
Excellent.
What a wonderful way to take care of your grandchildren. Thank you for joining us on the Cozy Lung Lounge today. Whether you're taking care of your grandchildren full-time or a couple of times a year, we'd like to make those times be magical for you.
See you next time.
Thanks for relaxing with us in the Cozy Lung Lounge, where we're all about helping you breathe better and living your best life. Don't forget to subscribe and follow for more insights, tips, and inspiration on your journey to cardiorespiratory health. Until next time, breathe well and thrive.